Today, we are going to talk about one of my favorite topics, Botox versus Dysport. Sometimes you'll even hear the name Jeuveau or Xeomin. What are all of these? I get this question all the time. Or I don't want the generic Botox, don't give me that, give me the real Botox. So these are different brands of the same medication. Well, very similar medication, I should say. It's like different classes of antibiotics. This is the background I always use for my patients. When we think of Botox, I call Botox the Kleenex of tissue. So I never ask my family, hey, will you grab me a tissue? It's, hey, would you grab me a Kleenex, please? And why is that? It's just a brand that we know very well. So it's a brand that's become synonymous with any sort of tissue. And Botox is synonymous with any sort of neurotoxin. So when you come in and you tell me you want Botox, I will still sit down and discuss with you what Botox is, what Dysport is. Those are my two main neuromodulators that I use in my office. Those are my two preferred neuromodulators, and we'll discuss the difference in those. At that point in time, I will always give you a choice, but you don't get to choose the amount if you want a specific result. So we are very budget conscious here. I'm a mom, you're a mom, everyone's got a budget. I understand that. I will give you a very clear expectation of what you can expect for the amount of units you want. And if you give me a number and you say, hey Liz, I can only do this much today, I will tell you what you can get for that. What I am not is a magician, so I can't promise you an expectation I can't deliver with the budgetary concerns that we have. But we can work together, we can develop a treatment plan, and that's really our job as your medical provider, as your aesthetic provider. We're a team together, you and I work together. Yes, at the end of the day, I am a medical provider, I am dosing a medication, I am practicing medicine, so I will absolutely kind of try to, I have the last say in what dose we give because I am practicing medicine. It would be no different than you going to the doctor and having an ear infection and saying, but doctor, I really only want 200 milligrams of amoxicillin. And the doctor knows that that is a dose for a small child and it's not going to make you better, and it will just make you either give you nausea or not rid you of the infection or make you resistant to the medication. So there's various reasons why we need to dose you appropriately. It's not just to get the max dollar amount. That's not at all the case. I will also tell you dose equals duration. That's a term that you'll hear my nurse injector Megan and I say frequently. So we know now that your duration of your neurotoxin, so your Botox Dysport, if you want to get to that 3 to 4 month mark, it has to be a high enough dose. If you don't allow us to give you the proper dose, then what happens is it wears off a little bit quicker. When you are only getting 2 months out of your Botox and you're coming into me every 2 months, you can get resistant to that product, we believe to be true. So I don't want to be the lady that gets resistant to Botox, and I don't think you do either, because I would like to keep my wrinkles away and I'm just not willing to take that chance. So we will also always talk to you about the duration of your product, especially there's other considerations we need to think about: your lifestyle, your metabolism, your body's natural composition, how long have you been doing these treatments, where you want your tox, because different muscles are of different strengths. But we will be happy to go over all of that with you guys in person, and we always give you different recommendations. Just know if you get Botox or Dysport, we will offer you both options. We have both options. They're both great products. They're both botulinum toxin. They're just made by differing drug companies. One is not the generic or lesser version of the other. We just recommend them for different muscle groups and strengths and your specific concerns. And we will be happy to give you that recommendation when you come in.